like to request Dr. Uzma Waqar Haq for her talk on alopecia totalis in young siblings. Dr. Uzma is working as a skin specialist at Quaid-e-Azam International Hospital, Islamabad.
Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Uzma Waqar and I work in Quaid-e-Azam International Hospital, which is situated at the interface of Rawalpindi and Islamabad. My case report, alopecia totalis in young siblings, is an intriguing case, and it spans approximately over a period of 1 year. There are two main objectives of presenting this case report. Primarily to emphasize on the holistic approach rather than going by the book literally, as stress is one of the major factors, and to highlight the short-term and judicious use of steroids in chronic and recurrent alopecia totalis. Let me give you a very, very brief discussion. Alopecia totalis is a non-scarring form of alopecia, which is both distressing and disappointing for adults, but more so for the children, as they have to bear the brunt of tears, undergo lengthy and cumbersome treatment, and face disappointment, as the results are not fruitful and the recurrence is common. Alopecia totalis is a condition characterized by a complete loss of hair on the scalp, eyebrow, and eyelashes may also be lost. It is an autoimmune disease, and approximately 20% of the affected patients have positive family history. I had the privilege of seeing two young males, aged 7 and 10, and with glum and fearful eyes were diagnosed in my clinic with alopecia totalis. They were born out of non-consanguineous marriage, they were full-term, they did not have any fetal anomalies, but they started to lose hair nearly 3 to 4 years prior to consulting me. On naked eye examination, the younger boy appeared with complete loss of scalp hair, eyebrow hair, and very sparse eyelashes. On close examination, he had a few streaks of light brown scalp hair, and the hair was thin but not easy to pluck. The elder boy had a similar appearance, albeit his patches of preserved hair on the scalp were comparatively dense. Each patch of hair was dark black in color, and it was covering the areas above the ears bilaterally. However, he had good growth of eyebrows and eyelashes. I could not find any scarring, but a few exclamation mark hair could be seen in both the patients. Gross physical examination did not show me any significant thing. There was no atopy, there was no nail pitting or fungal disease. They were well-fed children and had achieved normal milestones and did not have any significant past medical illnesses. The blood complete picture, thyroid function test, random blood sugar, and autoimmune thyroid profile was normal. Biopsy was not done due to the patient's father's refusal, and the family history had no similar occurrence. Their other brother was 5, and he was absolutely normal. Drug history is rather exhaustive and very extensive, as they've been seeing the doctors for the last 3 years for the same reason. They were given rithanol, multivitamins, lysine, 1% mometasone, and nutritional shampoo. They started to grow hair, but unfortunately lost it within 1 month. Another trial of clarithromycin, fluocinolone, was followed by minoxidil, injection methylprednisolone, 20 mg intramuscular monthly, and trocapril 2.5 spray was also tried on them. 1 session of PRP was done, but the young patients could not tolerate it. The patients came across to me very distressed and disappointed because the disease has severe emotional and psychological impact. I had a very long discussion with the patients involving the parents occasionally when and where required. The young patients definitely needed support, encouragement, empathy, and hope of all the medicines needed. Third-line treatment option was precluded as the children had a strong fear of needles and the family refused cyclosporine and PRP. I started the boys on minoxidil, it's 2% once a day, syruprednisolone 15 mg per 5 ml, starting with 0.5 mg per kg body weight with a tapering dose for 12 weeks. Clobetasol propionate once a day topical solution, and multivitamin syrup with triamcinolone acetonide injection half cc intramuscular monthly for 3 months only. They were called for successive follow-ups, and initially, after 1.5 months, I could see new hair growth on the lateral side of the scalp region. The most important factor to be noted was the confidence and bright outlook towards the disease by the children. They followed up